Hi there. Today I'm going to be talking about something that's kind of interesting to me. I really want to go into the medical field, so I'm going to try to keep this kind of short. There's a lot of information to give here, but I'm going to be talking today about GBS or Group B Streptococcus. It's also known as Group B Strep. So I first want to go in and talk about what is Group B Strep. So Group B Strep is a form of bacteria that typically lives in the intestines the lower intestinal tract and in the genitalia. It's found in both men and women, and it's actually in 25% of all healthy women. So while it's often harmless in adults, it can actually cause some severe complications in those who have a compromised immune system, such as infants, which is kind of what I'm going to be focusing on. It can also affect older people as well as those with previous infection or illness and also disease. So I'm going to talk about some signs. As I said, I'm going to kind of lean towards infants here when I talk about this stuff. So prior to birth, little to no fetal movement after 20 weeks gestation. Mother should be able to feel fetal movement at that point, so if you don't, there's obviously a problem. Unexplained fever during pregnancy, that indicates an infection somewhere. After birth, once the baby is born, if the baby is inconsolably crying, has abnormal shrill screams, or they seem like they're having trouble breathing with either fast or slow respirations, a specific change in color, that can also indicate a lack of oxygen. I want to kind of talk about the difference between signs and symptoms, because while many people think that they are the same thing, they're really not. So signs are something that's kind of like prior, maybe not prior, but like when the infection is first starting out. These are some things that are kind of like abnormal that you're kind of noticing. And symptoms are something that happens because of the infection. So it's like a cause of not really a cause, but it's what the infection causes. So some other signs are irritability, obviously, uncontrollable vomiting, if the baby is seemingly lifeless, not moving its limbs, tender skin to the touch, if they have any redness or fever, if the child is refusing to eat or not sleeping very well, those are all kind of signs of Group B strep. So some symptoms of Group B strep, so a baby who is exposed to the bacteria can develop bacteremia, which is a bloodstream infection. This can cause fever, chills. It can also cause the baby to have a low level of consciousness. They're not very alert. This can also cause pneumonia, which is where the lungs fill up with fluids. It causes trouble breathing, coughing, chest pain. It causes their oxygen levels to plummet, that kind of thing. It can also cause skin and soft tissue infections. Pus is an obvious sign of a skin infection, as well as warm to the touch, redness, swelling, that kind of thing. And it can also cause bone or joint infection, which ultimately causes stiffness. Let's talk about the pathogen and virulence factors. So, as I said before, Group B strep lives asymptomatically in a normal adult. So, when we're talking about infants, a mother who is asymptomatically carrying Group B strep can pass that on to their infant when the infant is exposed to vaginal fluids or amniotic fluids. So, Group B Streptococci, or the scientific name, bear with me here, Streptococcus agalactiae, I think is how it's pronounced. They are gram-positive, cocci meaning round, and they colonize in healthy adults, so they just keep reproducing and reproducing. So typically an infant is infected when they are exposed, as I said, to contaminated vaginal or amniotic fluid. They usually aspirate it. Once it is introduced to the host, the newborn is infected, and the GBS is able to adapt to the changing environment inside the host body. So let's talk about the life cycle for a second. So it asymptomatically resides in the vaginal canal or in the lower intestinal tract. It also is on the outside of the rectum as well. And it can get inside of the uterus in the carrier. So in the mother, it can invade the uterus. So once the uterus is contaminated, it also contaminates that amniotic fluid. The newborn then aspirates. It invades the lungs, causing pneumonia. Then it will also invade the bloodstream, causing, as I said, the bacterial infection in the bloodstream. And that can also cause septicemia, shock, and even organ failure. So then, once it's in the bloodstream, the blood then travels to the brain, and the bacteria will penetrate the protective barrier that covers the brain. And this will cause meningitis, which is a severe illness. And then I told you I would kind of focus more on infants, but that's because it's really unknown how older adults or those with chronic health conditions get it, and that's according to the Mayo Clinic. Epidemiology, over the past several years, microbiologists have gone really into depth to study the virulence factors and how these things spread and that kind of thing. So clinical practices in pediatrics, obstetrics, and microbiology have majorly impacted this disease. So as I stated before, women who are between the weeks of 35 and 37 gestation, which just means during pregnancy, they are required to test in order to kind of prevent group B strep from being from spreading more. So as I said, diagnosis, women between the weeks of 35 and 37 are tested for Streptococcus agalactiae. They're tested via pap smear, which is basically where a sterile cotton swab is rubbed. They swab the inside of the vaginal canal, and they also swab the rectum. That is then taken back to the laboratory where they culture it, and they then test for the Streptococci bacteria. Treatment and prevention kind of go hand in hand. As I said before, women who are pregnant are required to be tested to kind of avoid spreading that over to their infants. Once women test positive for Streptococci, they are given a heavy IV antibiotic to kill the bacteria before the baby is able to become susceptible. So usually this heavy antibiotic is given during labor in order to kill off all the bacteria right before the baby is born. If they were to do it any earlier, the bacteria would then grow back and the baby would be susceptible again. So usually they're given penicillin or a related drug of that sort. If they're allergic, they're given another form of heavy antibiotic. Women who are experiencing UTI, if they've had group B strep and tested positive for it with previous pregnancies, if they had fever at all during their pregnancy, or any kind of infection was expected or anything like that, if they went into preterm labor, those are all reasons that doctors will give heavy antibiotic during labor. Also, your water, it's kind of a barrier between the outside world and the baby. That's kind of what protects the baby. They're wrapped in the amniotic fluid, and once that bursts, the woman is susceptible to any kind of bacteria that is in the vaginal canal, i.e. group B strep. That way, so 18 hours after your water breaks, if you have not delivered at that point, you will also receive antibiotic. So, as I stated before, group B strep does live asymptomatically. However, those with compromised immune systems are susceptible to some severe infection and complications from the bacteria. So it's important that everyone be tested and treated because this is preventable. And that is all. Thank you for taking your time to listen to my video. I appreciate it.